Hi there, I'm Dr. Abdollahi. I would like to show you how to take your brace off and on safely without jeopardizing the repair of the rotator cuff that I've done on your shoulder. When you will go home the day after your surgery and you'll have a brace like this, I do not want you to try to remove the brace. However you go home, just leave it like that, and I will see you either the day after surgery or a day or 2 or 3 days after surgery, depending on which day of the week your surgery gets done. So when you come, and I will show you how to take a brace off and on in the office, but I want you to watch this video and learn how to do it, and so you've seen it once at least, so that you're more familiar with it and you have a resource to go back to. The brace can be removed most easily if you have somebody else to help you. If you don't, it is okay to remove it by yourself, and I'm going to show you that technique. There are 4 straps on the shoulder mobilizer, and these straps need to be taken off one by one. The first one we call the shoulder strap, and you can just undo the Velcro and slide it and throw it in the back. This one's the waist strap, and you can undo the buckle and let it fly. And this is called the thumb strap, which I'll put down here, and this one's called the elbow strap. Your immobilizer may look a little bit different than this, but the concept is the same, those 4 straps. And then to take it off, you can just put it on a countertop and just slide your arm away from it like this, and just let your arm hang by your side. Whatever you do, do not raise your arm up like this, because this arm has been operated on. If you try to raise it up sideways, that's going to begin to tear away the sutures that I put in there to repair your rotator cuff. So to put a shirt on, it's basically you'll be removing your brace every day to shower. So once the brace is off, you can remove your shirt as well, which I'll show you how to do. And then you will take a shower, and then you will get yourself dried up. When you're in the shower, I want you to lean to the right, if it's your right shoulder, and just wash under your arm this way. The gravity will naturally make your arm move away from your body without you having to raise it up there. So I do not want you to raise your arm up at all. So you go in there and wash like this, and when you're done, you'll stand up, you come outside, and when you're all dried up, you can put your shirt on. A dress shirt is easier because you'll not pull it over your head, but I'm going to show you the more difficult one, which is like a t-shirt. Try to choose looser clothing because it'll be easier to get off and on. And throughout this video, you'll see that I'm not moving my right arm at all. I'm just doing all the work with my left arm. So basically, get the sleeve lined up correctly so that you can pull this over your head once you've cut this far, and get it up all the way up as far as you can. Take your glasses off and pull this over your head like this. And the left arm will go the usual way. Notice I'm not using my right arm to help. It's just hanging out by itself. Okay, to put the brace back on, you can bend your elbow. You're allowed to bend your elbow, by the way. You can bend your elbow like this, and that's safe for the rotator cuff. You can bend your elbow by itself, and then grab your forearm with the other hand, and then gently move your arm out with the power of your left arm, and let your arm fall into the shoulder brace, which is sitting on a countertop at about this height. Once you're in there, you can stand up, and the weight of your arm will keep the brace against your body. Then you can reach behind you like this, and bring it around, and do the waist buckle. And you can do the shoulder strap next. The shoulder strap is the hardest one to reach, so it's awkward to get it back there. So you may want to use a countertop to help you like this. This way you can get it by yourself. If there's somebody to help you, of course, that's ideal. Then you put the Velcro through the loop and bring it up and put it at a certain position that supports the weight of your arm. I want this part here to be holding your arm up. I don't want you to be holding your arm up by yourself. I want the brace to do all the work. I don't want the shoulder to be doing any work. Then you do the thumb strap to keep the arm from sliding forward. And you do the elbow strap for a similar purpose to keep the arm from this arm coming forward. So this way you've basically taken the put your shirt on and then put the brace over it. It's nice to put the brace outside, not on your skin, to keep it clean. To take the shirt off, so this is how we took it off. I showed this to you earlier, so I'll go faster. To take a shirt off, basically try to pull it over your head. We'll let gravity, we'll let the arm hang down. And basically that's how you took the shirt off. So to put it back on again, we've already gone through it. The other things I want to tell you about is that after rotator cuff repair, for the first 3 weeks, I don't want you to take any anti-inflammatory medications like Motrin, Aleve, Advil, Naproxen. They tend to slow down the healing of the rotator cuff. You can combine hydrocodone, which is Norco, with Ultram if you need to get additional pain relief. If you take Ultram only, you can combine it with Tylenol, which will give you some additional relief. You can use ice to make your shoulder feel more comfortable. This way you don't have to take as much of the hydrocodone and the Ultram. Tylenol by itself is safe to take if you're not having that much pain and you just need something. But I would prefer you avoid the anti-inflammatory medications I mentioned earlier. If you have any questions, you can call my office at 949-499-8226. Susie is the surgery scheduler. She can be reached at option 4 with that phone number. And I will see you in the office soon. Take care.